continue here now. A story that we are tracking for you this afternoon, of course, International Nurses Day. We now chat to Denosa President Simon Hlungwani. Mr. Hlungwani, thank you so much for your time this afternoon. No doubt this is a very important day to be celebrating with nurses, or at the very least commemorating for nurses. But unfortunately, in South Africa, we know that for the past 2 to 3 years, nurses have been faced with one challenge from another. Just talk to us about just how difficult it has been in the couple of days and how you are reconciling that with today as you pause and reflect on the importance of nurses.
Well, thank you for having us, and greetings to your viewers. I must start by indicating that while we are celebrating this day as one of the profound days in which we must recognize the work of nurses of South Africa for their contribution that they made towards the development of the profession, but also servicing the public in general. We are faced with many difficulties at the current moment, but I must indicate to you that we are heading for a disaster if our country and our government does not take the call and heed our call seriously to addressing the shortage of staff and the problems that we're having at the current moment. As advised by the International Council of Nurses, as well as the World Health Organization in it that was titled the State of World Nursing Report in 2020. We are going to have more catastrophic events where we originally do not have a resilient public health system in South Africa. Hence, you have seen the devastation of COVID-19. Let me give you examples of what is going to happen. If you go to Limpopo, is the only province at the current moment that is not having an intake for the past 3 years. So it's going to be next year, it's going to be the 4th year. And if those who are in 3rd year and 4th year exits, there's not going to be an intake of any student nurse in Limpopo. And for the past 4 years, they have not been retaining those who have qualified after investing 5 years of government money to train them. Now, what does that do? The nurses that are retiring, nurses that are dying, and those who are just resigning are not being replaced. The situation becomes then worse, and we're even having, moreover, many other challenges such as the safety issues, the poor remuneration, but the working environment is not positive. So it's not a positive practice environment. As a result, nurses are having a burnout. We know a lot of nurses have died during COVID-19. A lot of nurses are still sick, and some got sick and complicated from COVID-19. But they've hired some people on contract, 3 months, 6 months, and some 12 months. They are not retaining them for on permanent basis, despite the fact that there is a real shortage. And they can see that now there is a rise of mental health cases or mental health illnesses in terms of the what we are seeing in the data. But also we are also having a rise of neglect of chronic illnesses in terms of treatment within the public health system. So the disaster will be there because there's a failure by a government to have a strategy that will provide for retention, but also recruitment and increasing the number of training of nurses. In this regard, World Health has given an advice, say, if you are to meet the goals in 2030, Sustainable Development Goals, you must increase the training by 8% on annual basis. But in South Africa, we are reversing the gains that we've had, and there's a prediction that we'll run short of nurses of around 30,000 in South Africa by the year 2030. Globally, it's going to be at 130 million. So we are saying this government must heed the call that is made by ICN, that is made by ourselves to come to the table and plan for the strategy. But they must invest in health, invest in nursing. That's our call.
Mr. Hlungwani, actually, the numbers are actually quite stark and shocking. I mean, in just the previous report, I read that there is a shortage of 20,000 currently of nurses. And as you've said, you know, even the private healthcare sector is calling on government to shift training regulations to fill that gap, as you say. But also the SA Nursing Council saying at this point in time, in some instances, there's one nurse for every 218 patients. Have you had engagements with the health department at all, particularly as you speak to those global numbers that you have to reach at a certain point in time? And of course, just recently we've heard that even from a budgeting perspective, these numbers are going to be very, very difficult to meet.
Yes, we have had engagement. What is disappointing is that currently, because of COVID, the World Health was able to indicate to us that there's a shortage of around 5.9 million globally. And in South Africa, as you have said, 20,000 that is predicted or has been revealed by that statistics. However, when you listen to the budget speech of government, they say they will reduce the government funding in terms of the health budget. It's going to be reduced in the next 3 years, which then means there is no seriousness in addressing the issue. Hence, we are saying we're heading for the catastrophe because there is no lack of planning, there is no strategy. We are just living and reacting. Although we have learned the difficult task and the difficult lesson with COVID, where many people have died because our health system was very poor and not resilient to the health pandemic. And you cannot predict and you cannot guarantee that in future we'll never ever have any health pandemics. Even the same COVID can change the situation the other way around, and we have a more dire situation. But without strengthening systems, we will not be able to survive as a country.
Mr. Simon Hlungwani, thank you so much for your time. That's all the time we have for this afternoon. And I really did want to touch on the safety concerns that are also being raised by nurses. But thank you. Let's leave it there for now. Let's continue here now.